Hi, my name is Brielle. I will be going over the safe administration and usage of nicotine transdermal patches today. These patches are used among patients that would like to limit their nicotine consumption and ultimately completely stop using nicotine altogether. I'll first go over the procedure a nurse will perform for inpatients before going over a very similar procedure that the patient can then take home and continue treatment safely on their own time. So the treatment plan for nicotine patches is typically an 8 to 10 week plan depending on the starting point of the patient's nicotine consumption. The more nicotine they consume, the longer the weaning process will be for them. Additionally, the patches come in multiple dose forms for the process of weaning the patient off of nicotine to avoid any adverse withdrawal symptoms. So for a patient that consumes over 10 cigarettes a day, their treatment will take about 10 weeks. They'll start with a 21 milligram patch a day for 6 weeks, move on to a 14 milligram patch once a day for 2 weeks, and then finalizing their treatment with a 7 milligram patch once a day for the last 2 weeks. For a patient that consumes less than 10 cigarettes a day, the treatment will last about 8 weeks for them. They will start the first 6 weeks on a 14 milligram patch applied once a day, followed by the last 2 weeks of a 7 milligram patch applied once a day. For teaching purposes today, we will focus on a patient that will have an 8-week treatment plan. Starting the patient on their patch today before they head home, we will go over all of the steps a nurse will do to apply the first patch and then teach the patient everything that they need to continue treatment safely at home. So before even entering the patient's room, I would verify that the provider has ordered for the correct patient, that they are getting a 14 milligram nicotine transdermal patch to be applied once daily to start their 8-week treatment plan. I will verify from the provider's order to the patient's medical record, making sure that it is for the correct patient, for the correct reason, and that they will be getting the correct dosage to start their treatment plan. So we will be getting a 14 milligram transdermal nicotine patch, and then we will be heading over to the patient's room to then apply the patch ordered for them and educate them on the teaching process so that they can go home and continue treatment. Hi, my name is Brielle. I will be administering and starting your 8-week treatment plan for your nicotine patches today that your doctor has ordered for you. Can you verify your name and date of birth for me?
Michael Edward Bowe, August 23rd, 97.
All right, perfect. And do you have any allergies to adhesives or anything else?
Do not.
All right, perfect. So you are starting an 8-week treatment plan for nicotine cessation. So we're going to try to get you to stop smoking, stop relying on nicotine. Your doctor has prescribed the 8-week program to start the first 6 weeks with a 14 milligram patch that we will start you off on, and then you will wean off to a 7 milligram patch that you'll apply once a day for 2 weeks then. And then hopefully at the end of that, treatment will have been successful. You won't be smoking, you won't be relying on nicotine, you won't have any adverse withdrawal effects. All right, so we are going to apply your first patch today. And Sandy, before we deal with the patient, all right, so when you are getting ready to apply your patches, you want to apply them at the same time every day, once a day. You'll want to apply them to either your chest, your upper arm, the back of your upper arm, as long as the spot that you're applying to is a clean patch of skin, there's no hair, it's dry. You want to make sure that you haven't applied any lotion or ointment to the area or any other medications to that area at the same time. You want to make sure that there's no rashes or open abrasions as well. You don't want, obviously, the medicine to infect anything in that area. So this is your 14 milligram patch. Are you comfortable with it being on your upper arm today? We'll get that situated. All right, so with your patch, you will just open it. There is tabs to open it on this side. All right, and there are tabs on the inside. There's two, so you will want to pull the first one off without touching the inside sticky part. We will press it down. You want to make sure that it is smooth, no wrinkles, there's no tears in the patch either. Then you'll pull the other tab off to get the other sticky side off. You'll smooth it out, hold it down for about 10 seconds, make sure everything, obviously no wrinkles, no problems with it, it's not causing any immediate irritation. So going forward, you will want to not place it on the same site. So you'll want to move it from this spot. So tomorrow when you go to put on your other patch, you'll move it. You can put it on your chest. And then so a week from now, you can put it on the same spot. But you never want to repeat the same spot within the same week.
Okay.
Now when you would go to remove that patch, you want to peel it off like normal, fold the sticky sides in on themselves, and then dispose of it in the trash, just so that you're not coming into contact with that medication on the sticky side. Everything remains clean, and you're good to go in there.
So just fold it in and don't touch any of it, just only touch the outside parts.
Yep. So you would also want to, since you're starting on kind of like a mid-level dose, you're still going to keep an eye out for any nicotine overdose symptoms. So any nausea, dizziness, chest pain, heart palpitations, anything that makes you feel awful. You'll call your doctor immediately, like take the patch off, call your doctor, he'll change your prescription, you'll probably come back in and get a new order from him. Do you have any questions for me then?
Not off the top of my head, I do not.
Okay, then if you can just go over with me then when you would apply it, how often you would apply it.
So I'm gonna apply it once a day, not the same spot, more than once a week, and I'll apply it at the same time on a consistent schedule every day. So whether that's when I first wake up or when I get out of the shower, whatever is easiest for me, but every day at the same time.
Okay, and what symptoms would you be looking out for in case to call your doctor?
Any type of sign that is nicotine overdose, so nausea, dizziness, you said chest pains, heart palpitations, anything of that nature.
Okay.
Call my doctor, and we'll take the patch off, call my doctor, and see what they're going to do.
Okay, cool. Yep, and you are more than welcome to call your doctor at any time if you have any questions or concerns. Like I said, also, you are more than welcome. So it does recommend that you wear it for 24 hours, but you can also wear it for 16 if you're having trouble sleeping wearing the patch. If you have any vivid dreams, nightmares, any issues like that, you can take it off at night and then reapply a fresh one in the morning. Okay. And go about it that way. All right, then you are good to go.